Welcome back to our podcast, everybody. And today we're going to be talking about two procedures that people come in for quite frequently and the differences and the similarities. So let's talk about laser blepharoplasty versus eye rejuvenation. If you're looking in the mirror and looking at your eyes and in and around them is aging you, as in the skin is crepey, you have some hooding, you maybe have a accumulation of sun damage in that area. These are the procedures that we would be talking about in your consult. So today we're going to go over what each procedure is, what the downtime difference is, what the outcome difference is, who's a candidate for each, and the longevity of the results and how long they tend to last. So let's talk about each procedure and what they actually are in plain English. So eye rejuvenation is what we call fully ablative lasers in and around the eyes. You may have seen it on social media or other procedures that we have done in videos, but basically it's when we use a laser to tighten very aggressively in and around the eyes. The whole reason we do this is to improve fine lines, help with the crepiness of the skin, sometimes retract some of that fat pad in the lower eyelids, and give you a nice subtle lift on the upper eyelids. It targets the under eye bags, the upper eyelid skin area, and includes the crow's feet area. The goal is collagen remodeling, and what that looks like is a tighter and brighter in and around the eye area. That can include a better skin quality, a better skin texture, and help with the fine lines and wrinkles in and around the eyes. Now let's talk about laser blepharoplasty. That in and of itself is a true surgical procedure. In a laser blepharoplasty, we're not using a knife. Instead, I'm using an incisional CO2 to make a very precise incision on the upper eyelids. It's aimed for patients who come to me and say, my upper eyelid is folding over and I feel like I have droopy or heavy eyelids. All right, so now let's talk about the downtime differences. For eye rejuvenation, we like to tell patients that the downtime includes oozing, goozing, redness of the skin in the area that was treated. So in the periocular region, that skin will be red, raw, and oozing for about 1 to 2 weeks. The redness then slowly starts to fade over the next 2 to 4 weeks. For a laser blepharoplasty, you're talking about some mild downtime, as in 7 days with stitches in the upper eyelid, but really no other oozing, goozing, or things like that. So you could wear a pair of glasses and return to kind of normal work at that 6 or 7 day mark. Then you will notice a scar in that area that fades again over time. But when you open the eye, you won't see that scar line. So in general, an eye rejuvenation, you want to think about you're producing new skin. So that takes about 1 to 2 weeks because the top layers of the skin are gone and that needs time to rejuvenate. So that can look like peeling, swelling, oozing, and goozing. Whereas a laser blepharoplasty, since I've taken out that skin, really you're just taking care of the stitch or suture line. Now let's talk about the differences in the outcome. The eye rejuvenation outcome is best for patients looking for an improvement in fine lines, deeper lines, and crepey skin. So you're looking at skin texture improvement. Now, as an added bonus, we do get some mild tightening in the range of 2 to 8 millimeters, and that's on the upper and the lower lids if we're treating them both. So you are going to get some tightness, but the primary purpose of that procedure is to help with skin quality. Overall, you're going to get a very natural looking, brighter and lighter in and around the eye area, which will overall make you look more youthful, as most people are drawn to look into people's eyes, and that's where we show age a lot. A laser blepharoplasty is a much different outcome, as far as we know exactly due to surgical planning how much skin and how much tightening we're going to be getting in and around the upper eyelid area. Therefore, it's best to address major hooding or major upper eye folds with a laser blepharoplasty. Now let's talk about what my patients ask me all the time. I want to look natural and I don't want a scar. What's the solution? That means that you're looking at eye rejuvenation because there's no incision. That means there's no scar. So I am improving the skin quality. I'm helping with the tightening, but you are going to continue to have the natural. And by natural, I mean your specific eye opening and that crease stays the same. I'm not altering. Whereas a laser blepharoplasty, you are going to have a small scar in the area that we took out that skin. So a lot of people ask me when they live in Florida, which procedure would you recommend? Now, for the reasons that we all talked about, there are pluses and minuses to each of these procedures. But a common question is, hey, I really like my outdoor activities. I want to return to them as soon as possible. Then you're going to look for possibly a laser blepharoplasty because after the 7 days where the stitches are removed, you can return to activity. Whereas if I'm lasering or doing the eye rejuvenation, we do recommend 30 to 60 days of really good sun protection and even sun avoidance. And that's to protect the skin that's new and to prevent complications such as hyperpigmentation after the laser's done. Okay, so let's go over what a true candidate looks like for laser blepharoplasty versus eye rejuvenation. Now, everybody is a candidate for eye rejuvenation as long as you have the skin type that can deal with the laser itself. So, when we talk about an ablative laser, we really want to be talking about lighter skin tones such as Fitzpatrick 1 through 3. Now, we do have other options for Fitzpatrick 3 through 5, but if that's going to be something that we're concerned about, then we'll discuss those options further when we do a consultation. Now, when we talk about a laser blepharoplasty, we really want an excess amount of skin where it makes sense to actually make an incision. So the risk versus benefit is really outweighed here. So, in general, we talk about a 10 millimeter overhang. So, what that actually means is when you close your eyes, you actually have some amount of hooding or still excess skin, even when the eye is closed. That's a pretty good approximation of 10 millimeters of skin. Now, some people have differences in laxity, so you can actually pull some more skin. So, that's just a kind of at home thing that you can do. But really, in the office, we would measure how much laxity you actually have so that I can kind of guide you as to whether true laser blepharoplasty or an eye rejuvenation is probably your best bet going forward. On the flip side, people come to me and say, I want a more open, lifted look, but I don't want surgery. Then you're looking at eye rejuvenation, and that's going to be a really nice natural way to get you that lifted, more relaxed look that you're looking for. Let's go over how long the results last because that is a question I get asked a lot. So, in our laser blepharoplasty, on average, those last about 10 years. So, you would not have to do any other around the eye procedures for about 10 years on the upper eyelid, which is a great thing to think about just as far as how long those results are going to last. If you contrast that to something like an eye rejuvenation laser, the skin quality, the sun damage that was removed is going to help you with collagen stimulation for several years to come. However, there probably is some maintenance to it, right? Every year we age, we get more sun, everything like that. Genetics plays a role as far as kind of how much laxity of the upper eyelid is. So usually I tell people every 1 to 2 years, you may have to return for another eye rejuvenation laser, even if it's a lighter version of what we originally did. Usually, when people come to me and we're talking about a laser blepharoplasty, or that is what they have elected to do, we often address the under eye using a laser. Now, that can come in different flavors as far as an ablative laser or fractionally ablative laser, but it's not that we're just treating the upper eyelid. We do rejuvenate the rest of the orbit or the rest of the periocular area. And that's really to blend and to make it look like more rested, more open, not only the upper eyelid, but also the lower eyelid and in and around the crow's feet. So, as far as the treatment plan, it's not that we're just doing one procedure. We do tend to stack or we do tend to combine procedures, especially if people are already electing to have the downtime and electing to have a procedure itself. So we can add the rest of the face, we can do the neck, we can do a bunch of different things that we're adding on to a laser blepharoplasty. But it's not just to say that we can only do that procedure on that day. We can and we do suggest really making a whole personalized treatment plan to address your concerns and to really address in and around the eye area or other things that you may think of. So let's wrap this up and really kind of give you the hard-earned facts of what these procedures are and which one you're going to choose. So If your main concern is skin quality, crepey skin, a minor amount of hooding, you're really looking at an eye rejuvenation laser. If your main concern is drooping, a lot of lid heaviness, really kind of running into the eyelashes, even affecting your peripheral vision, then I would elect for something like a laser blepharoplasty. Now, obviously, I want you to consult with a dermatologist or an ophthalmologist and kind of make that decision based on what you think is best for you, but also with a lot of guidance too. There is a subset of patients that we really have left out of this podcast so far that I do want to address just briefly. I do have a series of patients that they have already had a blepharoplasty, whether that be a laser blepharoplasty or a surgical blepharoplasty, and they're still left with a skin quality issue. So they still have crepiness, they still have some elasticity, and even though the skin is gone, the look is still overall tired, worn down, sun damaged, all those types of things. So those patients are ideal for an eye rejuvenation laser where the skin has already been lifted, but it just needs to be improved as far as skin quality. Thank you so much, guys, for tuning in, and we'll see you guys next time.